Dear Biba, we are very thankful for your creative workshop, and please tell me about your opinion for our students.
Thank you as well. I enjoyed every second of it.
Yes.
And it was, to me, an experience unforgettable.
Yes.
I think the students that we had were so eager to learn. They asked so many questions, which is always a sign of appreciation and sign of interest to the trainer.
Yes. Very good.
And it's so good to see them learn, to see them being passionate about SSBT, and to see how clever they are.
Yes.
So I was amazed, I am amazed, and very, very grateful.
Yes. Thanks very much. Please introduce yourself and your professional activities, and tell to my audiences about what you work now.
Okay.
Yes.
So I am a European from the UK.
Yes.
So I have moved countries, and I live now in the UK, where I work as SSBT trainer and practitioner.
Yes.
So I do both. I teach SSBT, but I teach it in a way that I show how I work.
Yes.
Because I think the two go together.
Yes.
And I am not alone in this. I have colleagues in the UK, Ben and Greg, with whom we have our Solution for Good Possibilities
Yes.
organization, and our common aim is that we want to inspire the next wave of practitioners. So we want to see more people being familiar with SSBT, being inspired by its simplicity, and not just therapists and counselors, social workers, but we also want people like everyday practitioners, like somebody working in hospitality, somebody working in bakery, somebody working with young people, somebody working as a street worker. We want people to adopt skills and techniques of SSBT and use it while working with other people.
Yes.
So this is my main activity at the moment, and looking after my practice and looking after spreading the word about SSBT around the world, really.
Yes. Very good. How you could learn SSBT?
Very good question, and thank you for asking. It's like learning how to dance.
Yes.
So I used to be a professional dancer at some point of my life, and you can enjoy dancing watching it.
Yes.
You can enjoy dancing reading about it. It helps your understanding, but it doesn't teach you how to dance. So you can only learn how to dance if you practice, and you need to practice every day, so you get better. And with SSBT it's the same. SSBT is not something that you need to be talented for. It's something that requires skills, and it requires skills of practice that everybody can learn.
Yes.
And they can learn only by practicing.
Yes. Practice is the base.
Practice is the base, and then of course it helps if you have other people, colleagues, with whom you can exchange your professional experience, and maybe your doubts, your fears, your questions, your successes. So somebody with whom you can celebrate. It's also good to have more than one person to, enrich the opinion. For instance, you would think in a certain way, and I think, oh, that's interesting. Somebody else might think, but I think in a different way, and then we can all learn from each other's diversity. So community is important.
Yes.
And also, of course, clients. We like to say that they're our best teachers because they show us things that we never thought of asking. Miracle question, rumor has it, or legend has it, was invented by a client.
Yes.
So there are many questions that clients teach us how to ask and what to ask.
Yes.
Yes.
Please tell me about your culture, your therapies, your supervisors in the way of solution-focused therapy.
Yes, I was extremely lucky that my first contact with SSBT was at Brief in London.
Yes.
So Chris Iceland was the first person I wrote an email to, He responded, he invited me to come for a visit.
Yeah.
And I didn't know much about SFBT then. And I just thought it was interesting, simple, which I liked.
Yes.
But then I needed to see if that's something that would suit me.
Yes.
Because, you know, you can be a great fan of jazz, but I have no lungs to play saxophone. I cannot play it.
Yes.
So I need to see if that's something I can do.
Yes.
So I went there. It's my first course 5 years ago. Not a long time ago.
Yes.
So, and I got hooked. So I really, really liked it. And I kept coming back to them, and they trained me, I guess, really well. So this was my start. And we have maintained a close relationship since. I have worked with them. I still sometimes work with them. They have helped me. They are my teachers, colleagues, friends. So those are the people that have been my first tutors and now friends and colleagues.
Yes, very good. Please tell me what's your own definition of SFBT and its goals?
Well, I thought I knew what my definition of SFBT was until today,
Yes.
when we had a very good discussion with our students.
Yes.
And it's good because it makes you think that how can you define something that is not a very structured theory?
Yes.
Because SFBT doesn't have explanation of what is going on between therapist and client.
Yes.
It has rather a philosophy which tells us maybe how we work and what our worldview of clients is.
Yes.
So in brief, of course, SFBT is an approach to change.
Yes.
So we're interested in helping people move forward in their life.
Yes.
And we focus on the future, so on hopeful, preferred future rather than regretful past.
Yes.
And it's also an approach that is, compared to maybe some other approaches, brief, so short. What fascinates me about it is its radical simplicity.
Yes.
But the approach itself, you can learn it with 2 days. Enough to understand.
Yes, it's not enough.
Yeah, it is enough to get the basic structure. Then it will take a lifetime to master it, yeah?
Yeah.
So we all learn, we will never stop learning. So it doesn't require years of studying. You can learn it quickly. But then, does that make you skilled? No.
Mm-hmm.
You can just understand the model. So it's simple. And does it work with everybody? Yes, it can work with everybody because it doesn't view clients in the same way as the dominant paradigm sees them. Because we see clients as experts of their lives.
Yes.
And I have never seen anything like this compared to other approaches.
Yes.
I have heard or read about it in other approaches, but when you see practitioners work, you see that they're not really doing it.
Yes. Thanks very much. Can you shortly tell me that what's the differences between SFBT and other types of therapy?
Yes, I think it's exactly that. The way how we see people we speak with.
Yes. And
SFBT practitioners, counselors, consultants, therapists would deliberately give up our expertise. So we know that we have it by default in every working relationship. It's always on the practitioner side where the power is, where the authority is, and where the expertise is.
Yes.
By default.
Yes.
So we deliberately give it up and give it to the person that we're speaking with. It doesn't mean that we're not experts on the process. Yes, we are. But what the client thinks is important, how they will change, what it is they want to change, will never be our assumption. Simply for the reason that we can never know what is best for the person we're talking with. On the other hand, they know. They might not know at the moment, but we will ask them questions that will help them know. And I think this is very unique to SFBT. And when you watch a session, you will see those assumptions in practice, because there will be no agenda in the practitioner, what the client should say, what they should do, how they should be living their lives, what question should work, shouldn't work. So all of that is kind of discovered in the conversation between the two.
Yes. Thanks. Very good.
Mm.
So, please describe the main differences between classical SSBT and what you do now.
Oh.
Okay?
Okay.
Modern or brief type of SSBT.
Yes. So first to say there is no distinction between which one is better.
Yes.
That's important to say. We have variety of SSBT practices.
Yes.
I think as many varieties as we have practitioners, because everybody has got their own style. But of course, as Steve DeShader's INSU and their team and others in Milwaukee have developed this approach, it was a starting point, not the end point. So the model was not fixed.
Yes.
It should have developed, and Men at Brief, Chris Iceland, Harvard, Evan George, they have developed it further in the UK, and they have followed the principle of Occam's razor, which means that they were looking for the minimal intervention to achieve the same effect.
Yes.
So that's the version I was trained in, and that's the version that fits with me, because kind of minimalistic. I like to think of myself as minimalistic. So the difference between the first model and the brief model, except besides being more minimalistic, is that, for instance, in the session, we would always stay close to clients, and there wouldn't be, in therapist's mind, space to think about the task, because we don't see task as necessary.
Yes.
It doesn't mean that we wouldn't do it or something, but it's not usual practice, and we have evidence that it's not absolutely necessary. So we can use the mental capacity that a therapist needs composing a task to stay with the client.
Yes.
So that's something that is different. Another very big difference is the starting point.
Yes.
Because, so the early model, they used to ask clients, what brings you here?
Yes.
So what brings you in therapy?
Yes.
And clients told a story, which was very often telling the practitioner about the problem.
Yes.
At brief, they looked into this, and then the miracle question, the original miracle question, was asked in a way, okay, so suppose you wake up tomorrow, and all your problems are gone. What's the first thing you will notice? So they said, okay, can we start with asking people what is it that they're hoping for from our work? So they discovered, or they invented, best hopes questions. What are your best hopes from our work?
Yes.
And that changed the way how they ask a miracle question, because now they ask a miracle question, so suppose you wake up tomorrow and your best hopes are happening.
Yes.
So not your problems are resolved, but your best hopes are happening. So it's a shift.
Yes.
So that's
It's a shift from problem to solution.
yes, and it's for them. I mean, if you see the evolvement, how they came towards this development, it was a natural state of events, looking into the clinical practice, questioning what are we doing, can we do this differently, can we do less?
Yes.
So other practitioners around the world have got their own thinking and their own development.
Yes.
So it's natural for the approach to develop and go different routes, and it shows that it's alive, and it's a good thing.
Yes.
And I think for SSBT community, it's good to cherish the diversity of approaches.
Yes.
Mm.
Thanks. You mentioned Chris Exton, Ivan George, and Harvey Rotner in your speech.
Mm-hmm.
I'd like to know more about them and their influences on your professional framework.
Well, they were my first touch with SSBT, so I guess I was lucky in one way,
yes,
that I came to brief, but I didn't know anything else then. Then I discovered later on that there are other schools, other training institutes, other versions of SS, and I was curious, I still am, but not in a way that I want to learn them, because I'm very happy with where I am. It's enough for me, and I don't want to do anything more than what is necessary. So I stick with my happy place, I suppose. So their influence was, well, when I was in their training, I wasn't a very good student.
Yeah.
I was full of confusion. I didn't make a lot of progress.
Yes.
My practice wasn't perfect, far from it. So in the diploma year, I had sometimes quite a rough time, which means that they gave me a hard time.
Yes.
But, in my home country, Slovenia, we have a saying that the horse that needs to be beaten up most
Yeah.
is the horse that is the best.
Yes.
So you don't want to beat the lazy horse because nothing is it will make no difference. So I think they put many efforts into my development.
Yes.
And they have supported me massively. When I introduced SFBT to Slovenia, they helped me.
Yes.
They helped me professionally with advice, with supervision, with Chris came to deliver courses with me. So we taught together. This was our first teaching together. And I think I am one of their closest students, I suppose.
Yes. Can you tell me what's the main characteristics of SFBT therapies or culture?
Of therapists?
Yeah. Main characteristics.
Yes, I think characteristic as something that you develop, not something that you are.
Yes.
In SFBT. So it's not, you don't have to be a certain type of personality
Yes.
or character to do SFBT.
Yes, it's attainable.
Yes, it's attainable. Everybody can learn it.
Yes.
So I used to be a total pessimist, if you wish. Still am sometimes.
Yes.
I'm not a person who looks for solutions every time.
Yeah.
Not at all. So you don't have to be, oriented in that way to do SFBT.
Yes.
So characteristic that you develop to be able to do SFBT well, I think one of the most important ones is to deliberately keep your mental hygiene into trying to not know anything about the client, not trying to interpret what client is saying, so to kind of understand the underlying meaning of their story.
Yes.
Because there might be nothing there, in between the lines. And this is very, very hard because our entire society is inclined towards trying to look for deeper meaning.
Yes.
Trying to figure out what the person is really thinking about.
Yes.
And in SFBT, we don't do that.
Yes.
We just leave everything with the client.
Mm.
And all we do is ask the next question, and this takes discipline. A lot of discipline, which I think is one of the main characteristics of a good SFBT practitioner of therapy.
Yes. In your opinion, is solution-focused brief therapy good name for this kind of therapy?
Yes and no. If you look at how the name was developed,
yes,
it's a good name.
Yes.
Because it was a response to problem-focused resolution of MRI.
Yes.
So they wanted something different, and they say, okay, no problem-focused, solution-focused.
Yes.
So if you know the background of the name, it fits.
Yes.
However, people who are new to SF or who don't want to spend time reading about the origins, who just want skills, fair enough, the name can be misleading.
Yes.
Because solution-focused brief therapy is not about solutions.
Yeah.
We are not finding solutions.
Yeah.
Our clients are finding solutions, yes.
Yes.
But actually in the process, what we do is we are describing circumstances where solutions can happen.
Okay, we believe solution building,
Right.
not problem solving in the process. Yeah?
Yes. Yes.
Solution building is main part of therapy.
I don't think it's even that. And now Evan George in my head is speaking.
Yeah.
When he said that what we do in SFBT is we build homes for solutions.
Yeah.
These are his words. So it's building descriptions of circumstances where solutions can emerge, but solutions are not important to the process. Solutions will come. But not necessarily in the process.
As Kimberg mentioned that clients will come to the therapy with solutions and go from therapy with solutions.
Yes. So it's not our task to find solutions or to be focused on solutions.
Yes.
So in that sense, the name could be misleading.
Yes. What's your agenda for your own professional activities in Europe or Asia and other countries and other side of the world?
Well, now it's September 2019. So next week is European Breast Therapy Association Conference, annual conference in Florence, where I'll be presenting a workshop. So that's an event that brings together practitioners, and it's nice.
All around the world?
Yes, it's international. I mean, it's in Europe, but people come from all over. And I hope Iranian students sometimes come very soon, and you certainly come. So that's what's happening next week. Then I'm going to Greece to teach SFBC in Greece. After that, I've got to go back to London. I'm teaching group work for an agency, and then off to India to teach SFBC in India. So that's in December.
Very good.
And in 2020, my calendar, my memory only goes until 2019. But we said that we would do things in Iran, so 2020 there is another workshop planned in Iran. And my hopes, well, I don't think I'm anything special, I just want to do what I like to do. And my hopes are that people, when they see me work, that they would get inspired and think, if she can do it, I can do it. And since I'm young and I'm a woman, I'm quite unusual character in the majority of therapies, not just SFBC, but therapies. I think it's an important message that I carry. So to be a representative of, say, the new generation. And I think it's very important that more young people or new people, not necessarily age doesn't matter, get acquainted with SFBC, because it's fantastic, it's terrific, and it's an anti-recipe for a burnout for the practitioners. And we know that in counseling, therapy, psychotherapy, burnout is a big problem. There we go.
Yes, thanks very much. Is there anything to say in the end of the interview?
Yes. I would like to thank you for your invitation. It was a great pleasure meeting you.
Thanks very much.
And I won't say it was a great pleasure working with you, because I think it's not the end, so we'll work together.
It's an honor to be at your service.
Thank you. And to all of our audience that might be listening to this, and would think, actually, that sounds interesting, maybe I will try. Do it. Try it. Go for it. You will not be disappointed.